Priority Health is raising awareness on social determinants surrounding our health, like how the places where people live or work can affect our health and quality of life. Joining us to tell us more is Priority Health Vice President of State Markets, East Shannon Wilson. Good morning, Shannon.
Good morning. How are you?
We're doing well. Thanks for joining us bright and early. Let's first start with what social determinants of health are.
The social determinants of health, or sometimes referred to as SDOH, are those conditions in the places where people live, work, and play that really affect a wide range of health and quality of life risk outcomes. And so these are social factors such as economic stability, neighborhood and physical environment, community and social context, the healthcare system, and even food and education. All of these are going to play a role in how healthy you are as an individual. And so we call these the social determinants of health.
Most definitely. So what are some of the findings that you're seeing right now?
We know that education, income level, these are all directly tied to longevity of life. They're also directly tied to your ability to live a healthy life. And so things like contracting more chronic diseases and things of that nature are all directly tied to how you're living, even outside of the healthcare institutions that we work on behalf of.
When it comes to COVID-19, what kind of correlation are you seeing, and how can we better our current standing if we might be in a negative role?
Well, we know that for centuries we've seen disparities across the board, and COVID-19 really furthered this pattern. And with each passing day, we tend to see more and more of the patterns around COVID-19 that are persistent in populations of color. We know that all of the social determinants of health are leading or contributing to the underlying conditions like asthma, diabetes, heart disease, and hypertension that make viruses like COVID-19 so much more prevalent in communities of color.
So what is Priority Health doing to address these health inequalities in our communities?
Priority Health, we are the largest nonprofit health plan in the state of Michigan. And so we know and understand that our work is deeply tied to the communities that we serve. And so we've been looking at the social determinants of health for quite some time now. And we have committed to driving high care value through effective and innovative programs. And so we're seeking to identify programs like our Centering Pregnancy work and our PAPA program that are really working to reduce the stress and provide or alleviate some of the social determinants of health that are faced by marginalized populations.
Wonderful. Where can we go to learn some more information?
One of the greatest places that you can learn information about social determinants of health is always going to be the Center for Disease Control and Prevention. In addition to that, we'd also recommend that you look into visiting our priorityhealth.com/SDOH website. This page will serve as a central hub for all of our content related to SDOH.
Shannon Wilson with Priority Health, thank you so much for your time.